Hello and good afternoon. I'm Dr. Charmaine Tu of Los Altos Family Chiropractic, and thank you for watching. Today we're going to talk about orthotics. Why orthotics? Well, first of all, many of my patients come in with ailments and problems that have a lot to do with their foundation. So for example, why would you build a house on sand? Well, your house is just going to slide away. We'd want to have some good solid foundation. And likewise, just like your feet, we want to have some good stable foundation, either through shoes or orthotics. So today I have with me Adam Chemist. And Adam is going to explain a little bit about what orthotics are and how they can help. So first off, Adam, what is your alphabet soup? What are your credentials?
I'm a board-certified podorthist, which is a pharmacist of footwear, a specialist in body mechanics, footwear, and insoles, and taking the combination to get a desired result to help alleviate discomforts or help recover from injuries.
So Adam, can you explain some of the ailments that patients have that you can help with an orthotic?
Common things would be plantar fasciitis, Morton's neuroma, heel spurs, Achilles tendonitis are all common injuries that can be alleviated and recovered from with a properly fit insole.
Okay. And Adam, can you show us an example of an orthotic?
Sure. An orthotic ends up looking just like a regular insole. The system that we use to accomplish this is using a topographical map of the foot via pins that will go through and give us a three-dimensional image of the person's foot. And from this impression, we then will have the computer cut the insole to a final product. It starts out as a block of material. You can see very thick and filled in. The computer mills the impression into that block, and with covers ends up looking like what most people are used to in the way of an insole, and this would replace what comes standard inside the shoes.
So Adam, question. A lot of my patients come in from seeing a podiatrist who's fit them in previously a harder type of material, either a carbon fiber or a really, really hard fiberglass material. When I send my patients to you, you usually fit them in something softer, more malleable. Can you explain why you prefer to do that and why my patients have such phenomenal results with the product that you have?
Sure. A softer device, something that has a little bit of give, works better as the foot is going to naturally be dynamic and moving, walking, running, just standing. And so a slightly flexible device allows it to adapt more to the person's foot and their mechanics than something completely rigid that eliminates the motion of the foot. There is a purpose for it, and there are times when a fully rigid device is necessary, but most of the people find that ease of use and comfort factor of a slightly flexible device is much preferred.
One last question, Adam. How often should somebody have their orthotic replaced?
These, being a softer material, will break down and compress, and so about every 2 years they should be replaced. This system uses a computer to manufacture the insole, which means that 2 years later we can cut the exact same insole with the same accuracy as we did previously. Whereas if something's done with a plaster cast or foam box, you may or may not get the exact same thing 2-3 years later.
And is there an advantage versus the plaster foam box versus the computerized?
The advantage to the computerized is the fact that we can do it in a weighted or non-weighted impression. And so we can accommodate for different activities or a person's body mechanics, and allows us more accuracy to see before we even cut the insole what we're going to get. So we eliminate any need for multiple adjustments on the back end.
Well, thank you, Adam, for being here today and sharing your vast knowledge with our audience. Could you please tell them where you can be found?
I can be found on the web at www.healthybarefeet.com or email at akemist@healthybarefeet.com.
Perfect. Signing off for the day, I'm Dr. Charmaine Tu with Los Altos Family Chiropractic, and don't forget, Adam can be found in my office on Thursday afternoons. So if you have any questions about possible IT band pain, plantar fasciitis, or any ailment that could be related to your feet, please find me at www.drc2.com. That's www.drctu.com. Stay healthy and well adjusted.